Dr. G.E. Ghali, the Chancellor at LSU Health. Doc, welcome back to Keel. Thank you for taking time for us. Merry Christmas, by the way.
Good morning. Merry Christmas.
You took delivery of the vaccines. What's the status now of getting that vaccine to your frontline healthcare workers?
Well, Aaron, we're starting later this afternoon and early evening to begin the vaccination process. And as you correctly say, we're going to start with the frontline folks, the nurses, techs, docs, residents, and fellows that are involved in direct patient care with COVID patients. That's really the first priority.
Will they be mandatorily required to get the vaccines or no?
No, ma'am. It's voluntary, and at this point, it's voluntary, and we don't expect it to be mandatory. But we expect a buy-in from the faculty and the staff in this process because it's really for the for the best. This is what's going to help impart herd immunity. And I want to stress this doesn't take away from the fact that we still have to practice social distancing and everything, certainly for a while, through the spring and possibly early summer until we get enough herd immunity created, partly through people catching the virus and partly through the immunization process. This is a safe vaccine. Everything that we've read and researched on it, it does not contain the actual virus itself. It's a messenger RNA. So what it does is it actually is administered, and it stimulates cells in the body to form what's called this spike protein, which is a protein that is located on the virus itself. And so it creates an immune response so that if the patient becomes in contact with the virus or someone who has the virus, then they already have an innate immune response to that and have antibodies already produced against the virus, against the COVID virus.
I assume that you guys are getting the Pfizer first, the Moderna vaccine down the line. How long will that be? Is there a major difference between the two?
Well, they're both messenger RNA type vaccines. The difference is the way that they have to be stored, and another minor difference is the second dose they're both two dose vaccines. The second dose for the Pfizer is 21 days, 3 weeks later. The second dose for the Moderna, which is held at a lower temperature, the Moderna needs to be stored at a minus 20 centigrade, which is like a regular freezer. The Pfizer needs to be stored at a minus 70 centigrade, which is kind of like wintertime in Antarctica. It's like minus 94. So we have to have special. So basically the Pfizer is going mainly to hospitals that have large hospitals that have the capability of having those type of freezers. Most of the nursing homes, skilled nursing facilities, congregate setting places, which is in the next round, that's where the Moderna is going to be used primarily in those settings.
Can I ask you a dumb question? Nothing new here, right? After you get the first shot, are you protected at that point from jump?
Well, you are certainly partially protected, but full immunity requires 2 injections.
Okay, so if you don't get the second injection, you're leaving yourself I can't say the word
vulnerable.
That's it. Yeah.
Vulnerable, yes.
Thanks.
You certainly are. You certainly are, Aaron. And again, I don't want to understress the importance of still having the social distancing, the hand washing, the mask wearing, particularly when you're in groups of people where you can't maintain distance. We really have, like I said the other day, this is sort of an early Christmas gift, getting this vaccine here and getting us moving in that direction. I'm going to get mine today. And I've already had COVID, and I more than likely still have antibodies to it, but I'm going to get it not because I think I need it more than someone else right now, but simply because I want to show everyone that I believe that it's a safe vaccine.
When's it going to be available for the general public? And that raises a question for me, because when are people like myself and Robert, who've already had COVID, we all obviously need to sit back and let it go to people who need the protection first, right?
Well, in theory, that's true. But, I would say by springtime, by springtime we should, maybe even late February, there should be enough produced that early in 2021 that the general population will be immunized. So that you shouldn't have to hold back just because you've had COVID. And remember, this is kind of like a seasonal flu kind of deal where this isn't more than likely a one-time in your lifetime injection. It may be something that may be required on a yearly basis, just like the flu vaccine would be.
Doc, we had Brian Crawford from, Willis Knighton on earlier this morning, and he said the attitude of healthcare workers, of people, doctors, nurses, he said yesterday when they started, today for you guys, he said it's people, try to explain to people how this is such a game changer, how this is literally, the way Brian phrased it was, the medical world is now on offense, we're not playing defense. I think you tend to agree with that, right?
Right, I think so. Like I said, this is an early Christmas gift, and really it couldn't have happened this fast without Operation Warp Speed. This isn't something that somebody just woke up one day and this happened. There was a lot of bureaucratic hurdles that were eliminated by the current administration in order to allow this to happen, and furthermore. The researchers these folks are of incredible integrity. I mean, they're not going to inject somebody with something that, unless they believe it to be completely safe. Does that mean that every vaccine always is without risk? No. But the profile, when the FDA gives an emergency use authorization, their belief based on science is that this medication, this drug, this vaccine, the benefits outweigh the risks exponentially. The benefits outweigh the risk exponentially. Yeah, go ahead.
One more dumb question. I just got a text from someone who's a medical worker who says we're required to get the flu shot. Why are the medical workers not required to get this one?
No, well, we don't. I guess that's each institution and each employer can do things differently. Here, we don't. We recommend that people get the flu shot. We don't mandate it. But if you don't get the flu shot, you have to wear a mask, and that's always the way it's been. Certainly, employers can mandate certain things. I think that the once this vaccine has been around for a while and people are more comfortable with it, they're all going to want to take it pretty much like they do the flu shot. But I can tell you that there's people that don't take the flu shot, and even around the hospital, and they have to wear a mask.
Mm-hmm. Dr. G, go ahead, wrap up, sir. I'm sorry.
No. I just want to thank you guys for covering this, and this is a sort of a really a miracle and a sort of a prize from the good Lord that we were able to get this quickly, and I think it's going to be a game changer, just like Brian said the other day.